And we heard the Minister of Health who came into the Senate and spoke about Head 28. And the Honorable Minister of Health talked about the Simangal report and attacked the UNC and attacked Kamla Prasad Bisesa and attacked Dr. Tim Gopi Singh, the Honorable Senator, by saying that they attacked the Simangal report and now it is their hero worship and so on. It was rather disingenuous of the minister, because if anyone would remember clearly, when the Honorable Prime Minister announced the Simangal committee being set up, he gave them but a mere week, and the instantaneous, immediate response from the Honorable Leader of the Opposition and the Opposition was that that was insufficient time to, at the time, investigate 3,800 deaths, to investigate 2 years of a COVID-19, to go and interview 20,000 health workers. That 1 week was ridiculous. But we have a minister who comes in here, brings quotes, plays games with the timeline in order to make a fake point, just like fake oil. So I just want to correct that and tell the minister that when you're debating here, these little games are not really wanted. Talk the truth, speak the truth, and give the facts. The Honorable Minister of Health also said we didn't reach. Their first mantra was, we're #1 in the world. But now in the Senate yesterday I heard, well, we're not #1, but we're not the worst. We were not like Italy, because Italy had priests waiting to say prayers for you as you enter the hospital. And we're not like USA, because them had dead people in refrigerated trucks, so we were all right. Well, that's not good enough, is it? So we did well because we were not dead last. That's the mantra of the PNM. When people were suffering and dying and every variant note a man was coming in here, the minister said he was proud. He's proud, proud, proud. Minister proud? 4,300 people dead. 92% death rate in the ICU. Specialists were ignored by the management and the government. Every variant known to man on the planet entered our twin island republic. The country was in a state of chaos and panic. Vaccination rates were low. No vaccinations were forthcoming. Vaccination discrepancies were made. The country has rewarded, said the Honorable Minister, the public servant team, the Dr. Parashram and so on. It wasn't the country that rewarded these people, sir. It's the PNM cabinet of a PNM award. So please take ownership of the award. The COVID-19 nightmare that we lived through. But somehow people feel you bury your head in the sand and just sing a mantra without statistics, without facts, without information. That is like a man coming 45th in the Olympics and telling himself and his country he came back with gold, and he repeats it over and over, and then the country rewards him for winning a gold medal. They feign for support and love for healthcare workers, but reward them with a tin of biscuit, and now the disrespect is complete with a total of 20,000 workers to divvy up 210 million TT dollars for risking their lives for 24 months in a pandemic, which, by the way, seems to be over all over the world, except here in Trinidad and Tobago, because last week in a 4-day period, 17 citizens died. Just because it does not make newspapers does not mean it did not happen. The citizens keep falling. 169 fully vaccinated people, citizens, are dead during this pandemic. All of them forced to take a vaccine that the government said there was no difference in the efficacy of different brands. And all 169, the report has shown, died who took that vaccine that was forced upon them. There was a mandatory vaccination policy putting people's livelihoods at risk, and you had to back back on that. You had to flip-flop. There was mask in a car with a wife and children. You finish eating doubles and drinking coffee at home, and you have to put on a mask in your car with your wife and your child. No testing for months leading up to the general election of 2020. Only 4,236 tests out of a 4-month period. And they said we're #1 in the world and called an election smack bam in a pandemic. The chief of staff and specialists at COVID Center forced to take instructions from a druggist and a playwright. Doctors were forced to decide where people were going to die, whether they die in waiting for an ambulance or whether they would die in the ICU. We got every variant here. 4,300 dead, 51% only vaccinated at this time, and yet the government and the minister celebrate.
46-1, please. We're talking about the budget 2020.
Senator Mark, is it that you are making the ruling on the Senator Roberts, continue.
Ma'am, thank you. Like an SEA student getting half a question correct or half marks, demanding applause. This is what the Minister of Health did in this budget debate. Looking for pips, mask, no vaccines. Take what vaccine you get, NDA for vaccines. The Ministry of Health's mantra has morphed from we're #1 to, well, boy, we didn't get as bad. We're not sure where he was for the last 2.5 years, but citizens of this country had to go to the ICU in Trinidad and Tobago looking casket sharp because the death rate was the highest in the world. How could you applaud that? That's not even politics. That's just wrong and heartless. At 1.92%, one ICU nurse for 50 patients. People are dying at home, and then you come to give $210 million for 20,000 workers, which works out to $457.38 per month that they work to save lives in a war. They work for $14.58 per day. Nurses and doctors who had to be locked down in the health facility in Debe would spend $500 or $600 for a 2-week period. They were working 2 shifts, and then you give them $14.58 a day for the war that they fought. You're looking confused. Do the maths. The maths in. It works out to $1.25 per hour. I cry shame. But you give the man who was there doing a press conference, listening to you and changing the science every day, an order of the Republic of Trinidad and Tobago. Come on, man. The same man who looked on at the PM telling citizens at the height of the deadly pandemic, come to Tobago.
Senator Roberts, there have been numerous rulings about references to third parties. And I'm going to ask you to not go down that path you're trying to go down.
Thank you, Mama. To this PNM government, this party that's in power, this government that has brought this fairy tale storybook budget, the results simply don't matter to this government. Facts and figures are relegated to mythical status. Merit is irrelevant. This PNM celebrates in the face of failure like a senator receiving $500,000 in a secret scholarship fund to fail all our exams, and spews ignorance and the piety from the pulpit to as a former PNM PRO. The PNM health policy is
Senator
to build...
Roberts, you are crossing the line again with respect to the standing orders. So I will ask you, please, to withdraw that last statement and move on.
The PNM health policy is to build an administration building, for hundreds of millions of dollars, and then the minister comes here in the budget and says that we will save $12 million in rent to administer. A surgery, an open heart surgery last week could not be conducted because you did not have these sutures to stitch up the man's chest, and you're talking about an administrative building. The central block, the minister boasted that the central block, the previous government did nothing, but it's 7 years. Where the central block? You want me to go and find it? Where to look for the central block? 7 years and $200 million later, no central block. Healthcare in a mess.